Hi there, I'm Katie, your safety trainer, and today we're tackling a vital subject for anyone involved in the healthcare sector. Whether you're directly interacting with patients, helping them move around, administering medications, or soothing them, you're performing essential tasks that unfortunately come with a risk of sprains and strains for you and your coworkers. Now, you might be asking, why should you, as healthcare professionals, pay attention to sprains and strains? That's exactly what we're going to uncover in today's video. We'll delve into the common causes of these injuries within your field and introduce some practical safe work practices. These techniques are designed not only to keep you safe, but also to ensure that you continue to provide top-notch care for your patients, all while safeguarding your own health. Let's dive in. All right, let's dive deep into understanding exactly what we mean when we talk about sprains and strains, because knowing the difference and the severity can really help in treating and preventing these injuries effectively. First up, a sprain. Imagine you're moving swiftly across the floor and suddenly you twist your ankle. That painful experience? It's often a sprain. This happens when the ligaments, those tough bands of tissue that connect two bones together in your joints, are stretched or torn. The telltale signs of a sprain include pain, swelling, maybe some bruising or a change in color around the area, a feeling of instability like you can't quite trust your joint to hold you up, and a reduced ability to move it as freely as usual. Sprains can vary in severity from a grade 1, which is pretty mild and involves very little tearing, to a grade 2, where the ligament is partially torn but not completely, and all the way up to a grade 3, which is a full-on tear of the ligament. That's when you really know about it. Now on to strains. These are a bit different as they involve the muscles or tendons, the cords of tissue that connect muscles to bones. Strains occur when these are twisted, pulled, or torn. Similar to sprains, strains can cause pain, muscle spasms, weakness, swelling, inflammation, and a limited ability to move the affected muscle. And just like sprains, strains also come in 3 grades of severity. A grade 1 strain might just be a minor stretch with no real tearing. A grade 2 involves more significant stretching and some tearing, and a grade 3 is the big one, a complete tear of the muscle or tendon. Enjoying this safety video? There's more where that came from on Got Safety Lite. Sign up for free and gain access to our library of over 1,800 safety videos. If we don't have the lesson you're looking for, we'll make it at no cost. Click the link to sign up today. In the healthcare industry, the day-to-day activities, while rewarding, can sometimes lead to sprains and strains. Exploring the common causes behind these injuries can be enlightening and serves as a crucial step towards prevention. Patient handling is a significant factor. It's an essential aspect of healthcare, but also a moment where careful attention is required to avoid injuries. For those interested in deeper insights into safe patient handling practices, refer to our patient handling lesson. Repetitive movements come next on the list. Actions like bending over to check on a patient or reaching for supplies can, over time, strain the body. Standing for extended periods also poses a challenge. The nature of healthcare work often demands being on one's feet for most of the day, which can have an impact on muscles and joints. The risks of slipping, tripping, or falling cannot be overlooked. Wet floors, cluttered spaces, or even an unexpected misstep can lead to injuries. Improper ergonomics is another contributing factor. The way movements are performed, how lifts are made, or even how workstations are arranged can lead to strain injuries if not appropriately addressed. A lack of physical fitness may increase susceptibility to sprains and strains. Being in good physical condition helps in coping with the physical demands of healthcare work more effectively. Lastly, insufficient rest or recovery time plays a role. The body needs time to recuperate from the physical toll of healthcare duties. Without adequate rest, the risk of injury escalates. Recognizing these common causes empowers individuals to take preventative actions, ensuring a healthier work environment and the continued ability to provide top-notch care to patients. To minimize the risk of sprains and strains, there are several safe work practices that should be followed. First and foremost, wearing appropriate non-slip footwear for the work environment is crucial. It's also beneficial to maintain healthy eating, drinking, and exercise habits whenever possible. Starting work with a stretching routine can significantly reduce the risk of muscle and tendon injuries. For those unsure about how to begin, consulting a medical provider for advice on a stretching routine is recommended. Ensuring that hallways and other areas are free from obstacles, debris, and spilled liquids is another vital step. These areas should be cleaned in accordance with the facility's policies and procedures. Rushing often leads to accidents and injuries, so it's advised to take tasks at a manageable pace. Work areas should be designed ergonomically to prevent strain, and any questions about ergonomic improvements should be directed to a supervisor. Adopting proper lifting techniques and limiting manual lifting to 35 pounds or less can prevent many injuries. For objects or persons weighing more than this, using teamwork, equipment, or assistive devices is recommended. All equipment and assistive devices should be used according to the manufacturer's instructions and the facility's policies. For information on patient lifts and slings, please refer to our patient lift and sling safety lesson. For tasks requiring more than one person, such as team lifts, maintaining proper communication is essential. This should be done following the facility's protocols. Taking all provided meal and rest breaks is also important for allowing the body to rest and recover. Should a sprain or strain be suspected, it's imperative to report it to a supervisor immediately, in line with the facility's procedures. To wrap things up, it's clear that sprains and strains are not uncommon in the healthcare industry, with the potential to range from the mild discomfort to injuries requiring significant recovery time. To mitigate the risk of encountering such injuries, adopting and maintaining healthy lifestyle habits such as proper nutrition, hydration, and regular exercise is crucial. Moreover, prioritizing the use of team lifting strategies and equipment over manual lifting techniques whenever feasible is essential, especially with the guideline of keeping lone lifts to 35 pounds or less. Ensuring that one's body has adequate time to rest and recover is another critical piece of the puzzle. If there are uncertainties or questions regarding lifting policies and procedures within a particular facility, reaching out to a supervisor for guidance is advised. That's all for today's lesson on preventing sprains and strains in the healthcare setting. If you found this information valuable, don't hesitate to connect with us on social media for more insights and updates. And remember, the goal is always to stay safe while delivering the best care possible. Stay safe out there. Is it again? The nature of healthcare work offers, often, a feeling of instability, like you can't quite trust your joint to hold you up. It does not like that line. You're just fine. It is looped. Let me just do that. It's today. It's all secrets. All of it. All equipment and assistive devices should be used according to the manufacturer's assistive devices. Don't hesitate to connect with us on social media.
Almost there.
Perfect.